Hello, everyone, and welcome to another special edition of Litter Media Live. Our interview today brought to you by Tomlinson Insurance. We're going to be visiting with Melanie Swisher, Executive Director of the Paint Valley ADAMH, and also Hattie Tracy, who is the CEO and, is it Vice President or President? President of Coleman Services, here to discuss the construction of a 24-hour behavioral health crisis facility. That interview is coming up right after this from Tomlinson Insurance.
This is Andy Tomlinson. When insuring what's important to you, our agents are there when you need us the most. Tomlinson Insurance, for the best coverage at the best cost. Visit us online at tomlinsonins.com to learn more.
We're back with Melanie Swisher and also Hattie Tracy. And Hattie, I want to just throw out a special thank you. I didn't know you drove from so far away just to be here today. Kent, Ohio.
Yep, absolutely. Kent, Ohio today.
Well, I hope there's some other things you can do while you're in Chillicothe and not just drive all that way for us, but we appreciate your being here. Melanie, we wanted to talk about this behavioral health crisis facility. First came out in the news when the multi-million-dollar grant was awarded some months back.
Yeah, so in 2019, 2021, we really started doing a deep dive on what type of crisis services our community needed and how we can improve on what we already had. We had a consultant come and do a needs assessment, and it was determined that we needed the services that I'm going to let Hattie talk about. And then the state also was really focusing on crisis needs, so they had a grant application process that we went through, and we were awarded that funding to build this facility.
Okay, Hattie, if you could tell us a little bit more about this facility and some of the intricate parts of it.
Yeah, so this facility really is a crisis center for the community. So it will be a 24/7 walk-in crisis center. So anybody who is having a mental health or substance use crisis will be able to walk in 24/7. They will be able to be triaged or assessed by a licensed clinician to kind of see what level of service do those individuals need. Can they go back home into the community? Do they need a higher level of care? And when we talk about a higher level of care, there is inpatient hospitalization. But however, there is also a crisis stabilization unit that will be a part of this facility. And it will be an 8-bed.
Yes.
It will be an 8-bed crisis unit. And so that really is a step down from the hospital. Somebody doesn't need inpatient treatment, but perhaps they're not quite at a spot where they can go back home in the community. So that's an area where we would be able to provide them treatment for up to 7 to 14 days. So we could look at what are their needs, what are they struggling with. We provide group treatment. We provide psychiatry services, so medication management for those individuals, just so they can get the treatment that they need. As part of this crisis center, we will also have what we call a 23-hour involuntary hold unit. So today, if somebody is in the middle of a mental health crisis and police are called or EMS are called, they're taking them to an emergency room or maybe sometimes even a jail, which is not really where they belong. And they're not necessarily getting the immediate treatment that they need. This 23-hour involuntary hold will allow us to provide a higher level of care for those individuals. So once again, we can triage them and bypass sending them to the emergency room or hopefully the jail, right? And we can provide treatment in the community where they really need it most in a very trauma-informed, client-centered or individual-centered way.
So while this is new to us in our area, how old is this concept of this type of a facility elsewhere?
Coleman has been providing crisis services out of these types of facilities since 1986.
Wow.
We've had crisis stabilization units that we partner with in the communities. Today we have 3 other crisis stabilization units, one in Portage County, one in Stark County, and one in Allen County. The piece of it that is a little bit newer to the state of Ohio is the 23-hour involuntary hold, but they have been providing these level of services in multiple other states, Arizona, Michigan, North Carolina, and Coleman's had the opportunity to work with RI International as consultants who Melanie and the board have brought in because they've provided this level of care in a lot of those states. Coleman has also had the opportunity to go to Michigan and tour some of their facilities and really look at how can we provide this level of care that has been missing in the community in Ohio. And I mean, Melanie talked about the state's investment and Governor DeWine's investment in crisis services, which is really allowing us to move this forward.
Melanie, other than the monies that we already mentioned that will construct this facility, how will it be funded once it's up and running?
Well, the state right now is working on regulations for this, and we're hoping that Medicaid dollars will flow. They've already got a Medicaid rate for the MRSS, which is the mobile team that's specifically for kids. So this is just like a time in history where everybody's working together to try to get this going.
And where will this facility be built, the proposed site?
Well, we are hoping that it's going to be built on the lot across from Cooper's Glass on East Main Street. We looked at several locations. We looked at land and buildings, and this really, we found that this was just the best place for it. People in the community need it. It's enough space to allow us to build it exactly how it needs to be. We were able to go to Michigan and look at their facility too. And I feel like right now, a lot of people in our community have to drive to Franklin County for services. And I really want people who live here to be able to have that access here. And this is our shot. We have funding. We're not going to have to use levy dollars to build it because we have this grant. And I just really want it to be the best that it can be for our community.
And this is for all of the counties, 5, I believe, that ADAMH covers.
Yeah, so we cover Pike, Pickaway, Fayette, Ross, and Highland counties. The thing that is unique about these type of facilities is that it's an open door access. So I get calls all the time of family members trying to find help for their family, and we have made the behavioral health care system too hard to navigate, and we're trying to help that. There's too many people falling through our cracks. We're trying to seal those cracks. And so this is an open door access, which also means if somebody from another county comes, we're not going to turn them away. I mean, we're not necessarily going to go and promote this in those other counties, but we have to have an open door access and be available for our community.
Obviously, the reason we wanted you in was to explain this program so the community would know, but not everybody's going to be watching this.
Right.
So what are opportunities that might be out there for the public to get more information about it?
So we are canvassing the nearby community, but if you have questions, please, you can email contact us at pvadamh.org. You can give us a call, 740-773-2283. My specific extension is 105, but if you dial 0, you might be able to get to us quicker. We're not always in the office. And I think one thing I want to make sure that I say is we have folks in our community right now who need behavioral health care services. And unfortunately, and we're finding this as we do this process, there's such a stigma. And really, we can't afford to have stigma because people pay for stigma with unfulfilled potential. They pay for stigma with their own human dignity. And honestly, people pay for stigma with their lives. Our middle-aged men are the highest rates of deaths by suicide. And there's such a stigma to reaching help. And even today, sometimes I hear, well, we believe in these services, but we want them somewhere else. But the time for hiding behavioral health care we can't do that anymore. People's lives are depending upon that. And so if you're listening today and you need behavioral health services, please don't wait until this facility gets built. Side Valley Mental Health Center has a 988 crisis line. Reach out to them. They can help you. They can get you connected. If you have trouble navigating our system of care, please call the ADAMH board and let me know. We want to make sure that our residents have access to the best care possible.
Right. Talking about stigma, I think sometimes we think that, well, I see those people out there that are having that issue. There may be somebody that lives in a 4,000, 5,000 square foot home that's making 6 figures a year that's got the problems that need help.
Absolutely. Mental illness and substance use disorder does not discriminate. And so we try to hide. I think sometimes we don't want to think about that. We want to think we're protected because we live in a nice neighborhood or have a nice home. But I mean, we all can list like famous people who've died by suicide, and people in our community are dying deaths of despair because they're not getting the care that they need. When a young person is handed a diagnosis of a severe and persistent mental illness, they're being handed a ticket to a death 10 to 25 years sooner than the general population. Yeah. we may not be able to impact that worldwide, but I think we have the shot to impact that in our community. And so we need to bind together and do everything we can to help increase access to care.
Hattie, because Coleman Services has been doing this for so long, you've got all of that experience under your belt. If you can just think about some things that the community might throw up a red flag and say, well, I have concerns about such and such. Talk about how the established facilities that you're operating have maybe answered some of those questions to show there's nothing to fear here.
Yeah, I mean, I think a lot of what we get sometimes when we're building these facilities is these individuals who are struggling aren't already living here. Yeah. Or bringing people who are struggling with homelessness, with drugs and alcohol to our community. And really, those individuals already live there. They're already struggling. We're actually bringing them in help and assistance. Not only are we addressing their mental health or substance use needs, we're also looking at what are the social determinants of health that they're struggling with. Are they struggling with housing? Are they struggling with food insecurities? And we're connecting them to resources in the community so that they can get the help they need. We also often hear a lot about, well, they're going to be waiting because transportation is going to be an issue. Coleman provides transportation both to and from our facilities to make sure that individuals are able to get there safely and that they're able to get back home and in the community safely. And in some of our facilities, we really struggle with individuals who come in and are homeless. But we typically have been able to keep those individuals, to help stabilize them, and to help them until they find stable housing in the community. So we understand that oftentimes there's a lot of pushback around that. We work really closely with police and EMS, especially with the 23-hour holds, right? And making sure that the facility is safe for the clients and for our staff and the communities. I mean, we want this to be a resource for them that's trauma-informed, that's really focused on what does the community need, what do the individuals need, and how can we better provide those services. And I think the other thing that I would add is that not only will people not be turned away regardless of where they live, but if we have youth coming in and families coming in, we're also going to provide those services to them. So we're not going to turn anybody away regardless of age either, which I think is important. And as we continue to grow the crisis center, I know Melanie talked about mobile response and stabilization services for youth in the communities, but we're also looking at, right, we want people to be able to come to us, but we also believe very strongly that it's important for us to go to them and to see them in their community, right? And to go where they're struggling. So we also hope to be able to do mobile response in the community and make sure we're going to people's home, make sure we're co-responding with police when they need it, so that individuals get the help when they need it and where they're most comfortable with it.
You know, everybody talks about, well, that's a red flag. Well, I think there's green flags too. And something that you said that was a green flag for me, we know that once the crisis is over, the problem's not finished, but you have resources to plug these folks into for long-term care. Absolutely.
And I mean, Paint Valley, they really have a lot of great resources in the community. Coleman's not coming in to recreate those resources. We want to help better connect those individuals to the resources in the community so that they can get their needs met, and also help identify if there are any gaps. What can we do to work together to identify those gaps so people and families, kids, adults aren't falling through the cracks?
Melanie, anything else that you want to touch on, and then we'll wrap up with Hattie after that?
No, I'm really excited to work with Coleman. I love what they're doing in other communities, and I can't wait to have them here doing that great work here.
Anything else to wrap up?
No, we're excited to serve Paint Valley and all 5 counties that it covers, and to bring the crisis services to the community and the families. We think it's important.
So the last question is when does it start?
Well, we had to ask for a conditional use on the zoning. And so that meeting is April 10th at 3:30 at the Chillicothe City Administration Building. So,
which is open to the public.
It is open to the public, yes. And I think that'll go from there.
Yeah, very good. Well, ladies, we got our fingers crossed. Hopefully this will pan out. Obviously, it doesn't take a rocket scientist to figure out we have a problem that needs to be addressed. We just can't keep sweeping under the rug. We've got to deal with this. And frankly, this has been one of the more exciting opportunities I think that we've had in a long time to, maybe get on the road. Into the right direction.
We're very excited.
Again, our guest on this special edition of Litter Media Live has been Melanie Swisher, again, Executive Director of the Paint Valley ADAMH Board, and Hattie Tracy from Coleman Services, discussing the construction of that behavioral health crisis facility. Our interview today brought to you by Tomlinson Insurance. I'm Mike Smith.